Hi guys, this is Dr. Behnam, board certified dermatologist. I practice in Los Angeles, California, and I specialize in PRP and stem cell hair restoration. I was one of the first pioneers of stem cell hair loss doctors in the US. Basically, I was one of the first people to start doing stem cells, mixing it with PRP back in 2016. And we've learned a lot in the past 7 years doing this. So in a lot of these videos, I'm here to share my knowledge and honestly just educate a lot of my audience about what's going on. A lot of people are still skeptical about stem cells, and that makes complete sense. I mean, I have patients that come into my clinic and tell me, "Doc, this is not gonna work." And you know what? And I'm fine with that. But I usually also try to explain and teach why it may work. And you have to realize that stem cell may not work for everyone. But I do believe that when you add stem cell, especially from the umbilical cord to your PRP, it's kind of like PRP on crack, and it's really going to boost your result. So today I'm going to demonstrate another patient. He's a young gentleman in his 20s who was losing his hair, and we did the procedure on him. So now I'm going to show you the before and after photos. So this is a before photo of March of 2022. So basically he came in, we cleaned the area, we numbed the area, and basically we did the injection. And look, he's thinning quite a bit right here, I understand. He told me that it really affects his ego and really affects his confidence. And he's an artist, and I think he just wants to, just like his arts, he wants his arts to look great. He wants himself, to look great as well. So this is back in March of 2022, and this is him in May of 2023. So let's look at the before and after. You could tell that basically he really thickened quite a bit, a lot in this frontal area. He feels more confident, and he's a lot very happy. And again, he's an artist, so he wants to look great. So, and what the procedure did, basically, it took a lot of these fine hairs that were already there and basically thickened them up. Now, in another one of my videos, I talk about patients, like who is a good candidate, who's not a good candidate for this procedure. He is a great candidate. And if you look at him, the reason is because he has a lot of hair, but when you look at his scalp, you can still see the scalp, but there's a lot of hair there. And what the procedure does is it basically thickens up a lot of these miniaturized hairs. And this is what you get. So he's very happy, he's very excited. This is another example of the procedure. Remember, stem cell PRPs are not necessarily for everyone. You have to really get evaluated, and also the technique of injection, the way how you inject it, the depth, how spaced you are, how many pokes you do really makes a difference. In his case, I literally do about 500 to 700 pokes in this area, and now you're gonna say, wow, that must be very painful. But I promise you, this patient is very comfortable because we did use laughing gas as we're numbing him, and he is fully numb as we're doing the procedure. So again, this is another case of a young gentleman with doing the procedure, and this is 14 months after the procedure, 14 months after. We usually say that stem cell PRP lasts about a year to year and a half, so it's definitely above a year point, so we're super excited. Again, hopefully this video did well for you guys and was educational. Thank you so much.